Greetings to everyone watching. For the Mental Health Awareness Campaign of 500 Women Scientists, we are here talking about the mental health crisis in STEM. We're asking the important questions and having the difficult conversations. Today, I have the great pleasure of talking to Dr. Jasmine Drake, who is a forensic chemist, associate professor, and acting chair of the Department of Administration of Justice at Texas Southern University. Hi, Jasmine. It's a great pleasure to have you here.
Hi.
Could you tell us a bit more about your research and background, please?
So my background is I have a bachelor's degree in chemistry. I have a PhD in chemistry as well from Louisiana State University. So I did a postdoc at the National Institute of Standards and Technology where I did neutron research. After that, I went on to work as a forensic chemist for the Drug Enforcement Administration. So I'm pretty much of a jack of all trades, I guess you would say. Hopefully I'm a master of something, but I've worked in a lot of different areas, a lot of cool science under my belt. I'm currently an associate professor and the acting chair in my department, and I teach a lot of students who are interested in criminal justice reform measures, as well as we have a minor in forensic science program. So I also teach those students crime scene techniques and how to, analyze evidence and how to collect evidence and things that they can use in forensic careers. I'm also a governor's appointed forensic science commissioner in the state of Texas. So a lot of hats here.
That's absolutely amazing. Thank you for your insights into your work. Let's dive into the questions of today. There is an indubitable mental health crisis in science and STEM fields, which requires immediate action. Women scientists and minorities in STEM are especially susceptible to this crisis. What are your perspectives on this?
So I am so glad that you have me here to get an opportunity to talk about something as important as mental health. I mean, I'm glad that we are starting to understand that people are people, and that even though we're great at what we do in a career, that we still have our own personal trials, we have families, we have all of these things that life brings. And especially as a minority in STEM and as a woman in STEM, it's been challenging, so I've had a great career and I've loved the places I've worked, but you do realize when you get into some of these spaces that you don't see any representation. And so you may see only a small amount of women represented. You may be the only one. And in some places I've worked, I'm the only Black, and then I'm a female. So you do have those spaces where that can be kind of intimidating. And you will also put that pressure on yourself to work even harder and maybe, work even harder so you can stand out, or so that you can get the same recognition that some of your male colleagues would get. So it's, mental health awareness is really important. I think that's a really big area that we really have to start to look at with these scientists, especially when we're looking at diversity and inclusion in some of these spaces that really haven't had that representation in the past.
Absolutely. I couldn't agree more. What have been some of the personal and proximal struggles that you have experienced or witnessed in terms of mental health?
So for me, I've always had a really great family support system and a great family and friends. And I have to say, first and foremost, that helps. But we still can't, prevent having that mental anguish and stress from being in some of these spaces. For some people, you could be the first person in your family who's actually went to college or actually went to graduate school. And I remember specifically for myself, once I started graduate school at LSU, the environment was very nice, and they were actually trying to increase diversity because LSU didn't have a lot of diversity, but it was still a lot of hard work, a lot of networking, making friends, and and just getting to where the work was challenging, but it was also rewarding once I was able to get in those spaces. But for me personally, throughout my matriculation, I've seen, where you can be really stressed out because maybe you're not getting the same treatment as other people, as your male colleagues, or even, other ethnicities or races. And so that can be really challenging. And who do you turn to talk to if you're the only one represented? So that has been something. And then I think a lot of us have that mentality, like we are the super women. So we may have family responsibilities, we may have work where we do a stellar job. And in all of these spaces, we feel like we have to be superwoman, and we may not have anyone who we can get to cheer us up or to talk about the experiences that we're having. So it has been really challenging. And it's not just for myself. I've seen friends and other colleagues go through the same thing, whether they're a minority, where I have friends who are Hispanic in different spaces, and they don't have anybody else represented there. And people don't culture also with other African Americans or Blacks. And you see where people don't understand some of there's some cultural differences. You also have things that comments that may be offensive and things. So I think that's where we need more diversity training and things like that in these spaces, but also the mental health resources for the individuals, where you can actually get some assistance with some of the things that you're dealing with in these spaces.
Absolutely. You've touched on some very important facets. My final question for you today is, do you have any advice for prioritizing and ameliorating mental health for women scientists and minorities in STEM?
Okay. I would definitely have to say that's a great question. And this is some advice that I wish I had early on. So I think that you have to take care of you first. And that's not being selfish. That's not being lazy. You have to have time to rest, to replenish. You have to find something that's your happy place, whether that's doing yoga, taking a walk, reading a book, doing something that's not work and something that's going to actually help you to be a better person. And so if you're not okay, nothing else is okay. So I've learned that, and I've learned that by, unfortunately through trial and error of maybe putting myself on the back burner, working so hard that you're sick, working so hard that you're later on the next week not in a good mental space. So I think it's really important. My advice would be, take care of you, take care of home, family first, and then everything else will fall into place. But we need to put more emphasis on self-care.